All right. Well, welcome everyone, and thank you so much for joining us and staying with us. I had a little bit of a technical issue earlier. Um, we are so thrilled to be here alongside our friends at LEAF411, which is a national nonprofit cannabis nurse guidance organization for today's conversation on medical cannabis and pain, what you need to know. My name is Nicole Hemingway, and I have the privilege of serving as the CEO of the U.S. Pain Foundation. At U.S. Pain Foundation, our mission is to empower, educate, connect, and advocate for individuals living with chronic pain to make sure that they have improved quality of life and better health outcomes. Today, we are going to cover a large array of information. We're going to have an introduction to LEAF411. We're going to learn about cannabis as a treatment option for chronic pain. We're going to discuss safe use and interactions and how to access support when considering cannabis as part of your treatment plan. Afterward, we will open the floor for a Q&A. So please jot down your questions as we go and submit them anytime using the Q&A icon at the bottom of your screen. So before we begin, just a few quick notes. This webinar is for educational purposes only. U.S. Pain does not endorse any specific treatment, therapy, or product. Always consult your healthcare provider before making any medical decisions. The views expressed today by our panelists are also their own and do not necessarily represent those of the U.S. Pain Foundation. As mentioned, we will leave time at the end for a Q&A, so make sure that you submit your questions throughout the presentation using the Q&A function. And finally, this webinar is being recorded and will be available later for viewing. So today I have the distinct privilege and honor to introduce our speaker. Katherine Golden is a registered nurse with over 28 years of service in the medical community, and she's been a pioneer in the field of cannabis nursing for the past 9 years. Katherine is not only the CEO, executive director, and founder of LEAF411.org, a national nonprofit organization, but she also holds key leadership roles in the cannabis nursing field. She has obtained several cannabis nursing certificates. She is additionally the CEO and founder of the LEAF Nurse Network. She serves as a cannabis clinical director for the state of Maryland, as well as a cannabis nurse consultant and a cannabis nurse care coordinator for the Colorado Department of Labor and Employment. So we are so grateful to have you here with us today. Thank you so much. We are so excited to learn from all of your wealth of information, and I am going to turn the floor over to you.
Thank you, everyone. Thank you, Nicole, so much. And thank you, U.S. Pain Foundation community, for having me today. I'm so excited to be here. I know this is a presentation, but to nurses, we love to teach. So this is my opportunity to teach medical cannabis and chronic pain to your community and help maybe open some new thoughts into what is available to you and your community. So I'm going to share my screen and we'll get started. All right. Can everyone see that? See my screen?
We can, yes.
Okay, perfect. All right. So here we go. Consumer education, cannabis for chronic pain. So you've already heard all about me. Yes, I've got a lot of experience in traditional nursing, 28 years, and also in cannabis nursing. So what I bring to the table is the experience of both, and it's a wonderful synergy because I can talk to people on both levels. Today, I'm going to overview is going to be an introduction into LEAF411, what is chronic pain and current treatments, cannabis for chronic pain, and how to connect with a LEAF411 nurse. And like Nicole said, we have time for questions and answers, so put them in your chat because we do have people monitoring the chat and we'll get your questions answered. So first, who's LEAF411? We are a 501c3 nonprofit. We operate the nation's first cannabis nurse guidance line. We have experienced nurses with cannabis medicine training and also that traditional medicine training. So when someone calls us and you have questions about maybe pain clinics and anything about pain-related issues in your traditional setting, all of us have that experience we bring to the table. So that's why we can talk very openly about these concerns. We provide community education. We provide answers to your cannabis-related questions. And most of all, we're accessible by phone and trusted and affordable. So our mission is to provide education and directional support to the general public about the safe and effective use of legal cannabis. And we'll talk about that. So first, chronic pain. I knew I didn't have to explain to this community, well, what is chronic pain? But what I wanted to do in this slide is really show that the different types of chronic pain have something interesting about them. So the nociceptive input is something to do with inflammation. There's neuropathic mechanisms that leads to nerve injury. And then there's an excitability to do with some chronic pains. But then also you can see mood, sleep, and cognition are affected by chronic pain. So I circled these because I want you to keep those in mind. We're going to talk a little bit later and start bringing all this together, why cannabis and chronic pain starts working beautifully together. So we'll remember these: inflammation, nerve, and excitability, plus mental health, mood, sleep, and cognition. There are different kinds of chronic pain, and we have a list of them here: cancer pain, arthritic, headaches, post-surgical, post-traumatic, and neuropathic pain. But as we know, it can always also lead to anxiety, depression, and insomnia. So there are many pharmaceutical management therapies. So you can do physical therapy, acupuncture, manual therapy. That includes like massage and chiropractor, exercise, CBT, cognitive behavioral therapy, and invasive procedures. So these are the non-pharmaceutical management. Then we have current pharmaceutical options. We have non-opioid analgesics. We have opioids, muscle relaxers. So we have a list of medicines here. So when you take a look at what you're currently using in traditional medicine versus what I'm going to show you, which is often labeled alternative medicine, you can see where they go hand in hand. So one of the main points to understand is no one's talking about using cannabis as a standalone treatment. Cannabis is always integrated beautifully, and there is 1,000% always a place for pharmaceutical options. We want to make sure and ensure that that patient can do their daily activities. So if you're needing opioids or muscle relaxers or an antidepressant, that means your body is saying to you, there's something a little bit off and it needs to have another chemical change. And that's when a pharmaceutical option works really well. We're going to show you what else is out there in the non-traditional medicine, kind of the alternative medicine space, and how they can be beautifully, how they beautifully work together. So let's talk about, well, what is that other alternative medicine? Well, we're talking about cannabis medicine today. So a lot of people don't know, but it's been used for thousands of years. We have evidence of that. We have it documented. And prohibition really prevented the research in 1937. So up until 1937, it was in the US pharmacopoeia, meaning doctors were writing prescriptions for it, and it was widely used. So we really do have a lot of evidence, we have lots of research, we have lots of physician and patients anecdotal evidence on how cannabis medicine was used in the early years. 1960, THC molecule was identified, and then in the 1990s, the discovery of the human endocannabinoid system. We're going to talk a little bit about what is that. So for short, we call it the ECS, the master regulator of all other body systems. So what I find fascinating is, wow, there's 11 different systems. You have your cardiac system, respiratory system, your inflammatory system. You have all these systems, and there's 11 different systems. Well, we found out in the 90s that there's this big umbrella called the ECS that helps regulate those systems. So now you start thinking like, okay, so here's this system that's regulating these. So when these are a little off, here comes the umbrella to help do what it needs to do to regulate these other systems. The ECS is responsible for homeostasis in your body. That means bringing balance to your body. and it helps with relaxing, eat, sleep, forget, and protect. So this is a little bit of science, but just so you kind of key into the words, it's really the words to understand, cannabinoid receptors. So I really wanted to key in on that word receptor because we mention it a little later on. There are receptors in our body, and there's these receptors called cannabinoid receptors. They're activated by cannabinoids, which we're going to talk about, which are part of the plant, and endocannabinoids, which I'm going to explain to you in just the next slide. So this is just a great picture to see that they're all over our body, and things interact with these receptors. So what are cannabinoid receptors? So they're activated by cannabinoids. So we have two. We have endocannabinoids, which endo means body, what you produce in your body, generally naturally inside the body. And we have phytocannabinoids, and that's what comes from the plant. So phytocannabinoids, plant, and think endo, body. So now you see that we have receptors that our own body makes these compounds that interact with, and then the plant also makes them that interact with our body. So I love this slide. I think this is fantastic. It helps us put a picture to what we're talking about, endocannabinoids versus phytocannabinoids. So you see, it's amazing when you look at anandamide, which is one of the compounds we produce in our body, compared to the plant cannabinoid, THC. Look how similar they are. So now you start putting that together like, wow, okay, now I can start understanding why when you introduce cannabis as a supplement, why it might help our bodies. Because if we're not producing enough of our own cannabinoids, of the one the body makes, that's why there's theories out that we are deficient in some of these compounds in our body. So when you introduce a supplement, and that's what we kind of refer to cannabis being, the supplemental medicine, then you kind of see why, oh, now I know it's why our bodies work better. It's because we have this compound in our body. If we're not producing enough, or it's being destroyed too soon, when we introduce a supplement, it helps us. It's cannabis sativa. And what do we use from that plant? Roots, leaves, stems, flowers, and seeds. All the parts of the plant are useful. What's in that plant is what we call the entourage effect. We've got over 150 different compounds in the plant. What most people hear every day is THC and CBD, cannabidiol. But you can see from this slide, there's quite a few. And there's not only just the parts of the plant as the compounds, but there's flavonoids, there's terpenes you can see here, and all of them are just this beautiful symphony that work together. And you're starting to probably hear a few more mentioned. CBG, cannabigerol, I know is one that dispensaries are starting to carry. You might see it online. You can see CBN. Some people refer to that as the sleepy molecule. It's really not, but there's a lot of science that shows you kind of what all of these parts of the plants do and how beneficial they can be. So that's what is made up in the cannabis sativa plant. So talking about still those phytocannabinoids, the plant. So looking at the different compounds, you can see in this slide that even when you look at CBD, there's evidence showing it can treat pain, inflammation, and anxiety. And then you look over and you see THC. You're like, wait a minute, pain, anxiety, inflammation. And then you can see some of the other ones, pain and inflammation. Now you start putting it together that, okay, here I have this plant that has multiple targets. I can see that I can use some of these plant compounds to treat my chronic pain, but in turn, that same compound can also help my anxiety, can also help my inflammation. And this is where it works beautifully for chronic pain, because now going back to that slide that I circled all those key words, inflammation, excitatory, all of these words, mood, sleep, you can kind of see that, even insomnia here that I didn't circle on THCA, wow, that helps that too. PTSD, it's got a lot of different targets, which makes it very different from a pharmaceutical. Pharmaceutical has one target and one receptor it targets, and then that's usually the pain receptor, and that's what it treats. How do we soften that pain? But typically it's not also going to help inflammation and anxiety. So that's where now people are starting to learn that, wow, the cannabis plant is what we call promiscuous, meaning it doesn't have just one target, it has lots of targets. So now you can start putting together, okay, now I see where phytocannabinoids or the cannabis plant can be beneficial. So let's talk about that plant again, cannabis sativa. That's the name it's called. And we have two places where you can purchase the cannabis plant: in a dispensary, and you can purchase it online as hemp, or even in hemp stores and things like that. The difference is that dispensaries are regulated by the states. Either a state is a medical state or medical and adult use state. That means over the age of 21, you just have to have a driver's license. Products may contain large amount of THC. So when you have somebody that is has been using cannabis for a very long time and they need more than what's carried on the adult use side, then they can at least actually go to the medical side, use their medical cannabis card, and purchase larger amounts. And say, for example, there are people that live in very rural areas and they really need to stock up. This is what's beneficial for them. If they have their medical license, then they can go to a medical dispensary or buy a larger amount of their medicine and have that at home. Because we have people that we've heard from all across the country that have to drive hours to get to their local dispensary to purchase. So it's really ideal for them to get their medical license so that they can purchase larger amounts and not have to make that trip, because some of them are very limited on transportation and just the physical ability to get out of the house and drive a car and go to a dispensary. Then dispensary cannabis is tested for contents and contaminants. So it's very wonderful way to be regulated. And that's why we are very much advocates for purchasing your cannabis in a legal dispensary, because all those states have it highly regulated. They have to have it tested. There are COA, certificate of analysis, which I'm going to show you later in the slides, that are provided that shows you everything in that plant. So it's wonderful. So we do have patients that say, well, I don't know if it's safe to buy in a dispensary. And now, you know, looking at the slide, it's regulated, tested for contents and contaminants. So it's a very safe product to purchase. Then you have the hemp. So hemp in 2018 was legalized through the Farm Bill. It is federally legal. There are a couple states that are cracking down on it and still don't allow it to be shipped to their state. It depends on the THC. So people sometimes get confused and they're saying, wait, I'm looking at a hemp product online that I can see has the same amount of THC that a dispensary has. How is that possible? So it just has to have less than 0.3% by dry weight. And that's where a lot of companies have kind of skirted around and figured, well, if I test it at dry weight, but by the time I formulate it and package it, it's actually higher amounts of THC. So you have to be very careful. And that's another reason why we have a service to help answer questions, because a lot of consumers don't realize how much THC they're actually taking when they purchased a product online. They think they are only taking high THC if they purchase a product in a dispensary, but actually that's not true. You can get large amounts of THC, or larger than you expected, in a hemp product. Testing is not required, and that's the bummer about hemp right now. So we call it a little bit of the Wild West, because they're not state regulated, so they can market and sell whatever they want. So you have to be very careful, read the labels, make sure that it is a quality company. You know, there's criteria that we always, as an organization, look for in a company, that they're very transparent with the consumers, very much open about giving you that certificate of analysis if you request it. They have a contact area, so you know there's a phone number, there's an email you can contact them. So there's lots of criteria that we as a nurse organization look for in a hemp company. So we wanted to make sure we can provide those resources for you. Quality brands provide, and quality brands will always provide those certificate of analysis, and we're able to kind of guide you and show you what to look for. So methods of consumption, these are in your dispensary products and they're in your hemp products. So we're looking at the different types of, we call them methods of consumption or routes of administration. We have inhalation is the most widely known, is how to smoke it, or vaporization, where you just heat it and it creates this vapor that you inhale. People know it the most. It's the most, I think, used in some marketing for pictures. So that's why people kind of start assuming that that's the only consumption, which it's definitely not. You're going to learn here that it's just one form. It has the fastest onset, so, and it has the most control because it has a short duration. It only lasts a short amount of time. We're talking 2 to 4 hours. So when somebody is in this really sudden acute pain and they need something fast and quick, inhalation can be a method that they use and they like. So we tend to find people using it for breakthrough pain, after they have something that they're using around the clock, something extra to help them through difficult times. Flower versus concentrate vaporization is very important because we want to make sure that you're consuming the most healthy way you can. So most practitioners, this won't be a method that they advocate for. They'll just say, okay, if it's something that you need for breakthrough, here's how to use it safely. And that safely would be flower, so always using the actual plant and heating it to where it is just vapors that you inhale versus lighting something and creating combustion, because that has carcinogens. So we put that aside and we say, you know, that's really not a healthy way to take in your medicine, but vaporization can be, because just think of vaporization as having a pot of boiling water steaming over your stove and just, you know, inhaling the vapors. So that's kind of what you think about when you're a vaporization with flower. So it can be done very safely. There are also tinctures and drops. Variable onset, so it all depends on how this product is created and it's formulated. So it can last 4 to 6 hours, typically in oil. So that's kind of the confusion when you hear of something called a tincture. Traditionally, a tincture is made with an alcohol base, so it does have a quicker onset. Most tinctures out there are really oils and not alcohol based. They're typically made with a coconut oil, what we call an MCT oil, non-flavored oil that you swallow, and it can even be olive oil, or some use a hemp seed oil, and that is mostly swallowed, so we call that more of an edible route. But just so you know, tinctures are widely used, that word, and if you're looking for something that has a fast onset and a true tincture, then you have to look for something that's alcohol based. So then we go into edibles and capsules. So this is a really wonderful way to have your medicine. We have both spectrum. We have people that say, I'm tired of taking what looks like medicine, capsules. I take so many capsules a day. I want something different. And then they have edibles, which to them is like a treat. Instead, it's like, oh, I can take my nightly gummy that doesn't feel like I'm taking another medication. Some people like that, and some people are opposite. Like, you know, I don't know how comfortable I am feeling like I'm taking candy as medicine. I want something that truly looks like medicine, and they love the capsules. So it's wonderful that the cannabis industry, the manufacturers, have really tried to, you know, zone in on what the patient could want and what would help them be compliant, or, you know, really want to stay the course with their medicine. So they have these different methods of consumption. We also have topicals. Topicals are great. You know, you put it on your skin, the molecules are just not large enough in a true topical to get through to your bloodstream. There's only one type, which we're going to talk about next. But most topicals are your salves, your creams, your oils. They act locally. They last 1 to 3 hours, and there's no side effects because they don't go through the skin into your bloodstream. So you can put that on multiple times a day. A lot of people have great success with the pain in their hands, the pain in their knees, the chronic pain they're feeling in their back. So it's a wonderful way to start layering in different types of treatments. So it's a perfect place to start if you have someone that's very nervous about going into a cannabis journey and saying, oof, I don't know if I'm comfortable swallowing something yet. Topicals are a great way to tiptoe into that swimming pool and decide, okay, I think I feel something here. I feel some relief. Maybe I can start feeling more comfortable with cannabis. And the last one is transdermal. So a lot of you know about the transdermal pain patches. Well, the cannabis industry, there's a couple of companies that have created their own transdermal patches. So they're onset of 15 to 30 minutes. They come on quick, but they last long, 12 to 96 hours, because you leave that patch on, and it's different from the other patches you use with your pain. These patches are used on the insides of your wrist, so in your venous, where your veins are, and the inside of your ankles. And it's wonderful because it does have a carrier that takes that medicine from that patch into your bloodstream. So that's why it's different from a topical. So anything that says transdermal, you have to assume that it's going to at some point go leak through into your bloodstream. But what's beautiful about transdermal patches is they bypass the liver and the intestines. So you're not swallowing it for your GI tract or intestines to have to metabolize and break down. It goes right into your bloodstream. So what is it just like? Inhalation, the first one. So people love that because of the fast onset. You inhale some of the vapor and it gets right away into your bloodstream. So some people say, well, I want that effect, but I don't want to smoke. Then transdermal is a good place to go. So another thing that you're going to see on packages about cannabis in that hemp space, in that dispensary space, are ratios. You're going to see these numbers and you're going to think, okay, what do these numbers mean? That's something we can help you with. But here's a quick little chart on understanding. So high CBD, low THC. Most companies will put CBD first and THC second, but don't count on that because there are companies that have reversed that. So you have to actually read what it says as the first part. Is it CBD or are they talking about THC? And what is the second part? So right here, this 50 to 1 means it's 50 parts CBD to 1 part THC. So thinking 50 milligrams of CBD to 1 milligram of THC. Long time ago when hemp was first coming out, all hemp products were around here, a 50 to 1, a 40 to 1, because that's where they knew they needed to be. Then a little bit of that, workaround came out. And so now you could even find some of those products being 10 to 1, 5 to 1, and we go down the line. But really what the hemp should hang around is the 50 to 1s, the 40 to 1s, and even the 20 to 1s you can even find in dispensaries sometimes. And that's 20 parts CBD with 1 part THC. So now you can look at this kind of half wheel and see, well, the more CBD you have, the less you'd feel of these THC effects. So, because it's a balancing act. So that's what ratios are. So when you come into a 1 to 1, what that means, it's an equal balance of CBD to THC. So if someone takes enough of that, they are going to feel the THC effects. So a lot of people say, well, okay, I don't mind feeling those THC effects, maybe for bedtime, but maybe for the daytime, I should start to find something that's more in this 50 to 1, 20 to 1 area that I won't feel those effects. So ratios can be a little bit overwhelming sometimes, and that's why we're happy to talk to you about how to read these. So now looking at what those COAs are, this is just an example of one hemp company that's very, very compliant. This is what they all should look. This is the gold standard, telling you what parts of the plant are in there, what it's been tested for. You want to know the heavy metals, residual solvents, and then the terpenes. And these are remember that chart that had the entourage effect, terpenes, which kind of gives it the smell, and the flavors are all in there too. And this company shows you what's in there. Potential adverse effects, anxiety, sedation, dizziness. There could be adverse effects, and that could be a sign that your dose is too high. We know Cannabis can be used when people are taking other pharmaceuticals like opioids, but the THC opioid synergy allows some people to reduce opioid dosages. So it's not contraindicated where you could hear that word. There's just caution. Cannabis can cause blood pressure fluctuations, especially with THC. So you have to be careful with that. And it's always due to the amount that you take. Blood thinners, THC, and alcohol. Alcohol may increase the level of THC, so you have to be very careful if you drink alcohol. One of the number one questions we get all the time, what about drug to drug interactions? What about drug interactions? And our answer is always, it depends. A caution that a drug interaction could occur does not mean that it always will. And that's when we ask you, well, what's that medication you're concerned about? There's online resources that you can use. We give you articles in our free library on how to find those software platforms that you can actually type in the name of your medication, type in cannabidiol or CBD, and it tells you if there's an interaction. So lots of resources. So cannabis and opioids, scientific evidence shows that cannabinoids, now remember those, that's what we've been talking about in the cannabis plant, are 10 times stronger than morphine for pain management. Cannabinoid and opioid receptors, thinking back on the receptors, are grouped together throughout your nervous system. Remember, we saw all of those receptors. THC and morphine have synergistic effects on chronic back pain. So again, never having to choose one or the other, opioids or morphine or pharmaceutical or cannabis, synergistically, they work really well together. Stimulation of cannabinoid receptors causes the body to release endogenous opioids. So here we go with that endo name again. So we actually have opioid-like compounds in our body, and when you take in cannabis, sometimes that causes the body to release more of that. And then what does this do? It helps us reduce some of those supplements we're taking, some of those pharmaceuticals we're taking. So we want our body to work at its finest. So combining low-dose one-to-one products with opioids can allow for a decrease in opioid use. So a lot of people say, I really want to look at reducing these opioids because I have side effects. And that would be one of the key reasons why. So lower opioid doses, decrease side effects, may help prevent opioid tolerance, can extend opioids duration of action, and ease symptoms. So one of the number one side effects of opioid use is constipation, and there can also be some brain fog. There can also be limited restrictions on driving and things like that. They just want to get away from some of the opioids used so heavily. It works well for them, which is great, but maybe they want to ease some of that constipation. So that's when you start combining some low dose cannabis, and then you can start reducing some of that, some of those opioids or prescription medication, but always with the guidance of your prescribing physician. So here we go with safe conclusions. Cannabis is not risk-free. Cannabis is not a magic bullet. It can be used safely, and it absolutely can be used unsafely. So we always talk about needing clinical guidance. When cannabis is clinically guided, then you get the best results, because not only are you going to be guided to use it safely, but really important, effectively. And that's key, because you can try any cannabis, even low dose, and you say, okay, it's safe, but it really didn't work for me, because it's the effectiveness. Are you using the right parts of the plant? We looked at that wheel again and saw where they touch inflammation, where they touch, pain, and making sure you're using the right combination of that plant. CBD likely buffers many potential risks of THC, but we still have to always talk to people about that. And cannabis is just one part of comprehensive treatment. We like to kind of weave it in slowly, test how your body tolerates it, because everybody's different. And then if it makes sense to reduce some of your pharmaceuticals, great. But if not, sometimes those pharmaceuticals are working, but just not well enough. And then the cannabis comes in very slightly, and then, wow, now you're having some pain relief. And that's the beautiful part of it. So how do you connect with a LEAF411 nurse? Here's a picture of our website. It's really easy. You click on that big white button. You can get personalized nursing guidance. We do a follow-up email that lists pages and pages, probably more than you could have ever imagined, of resources on, what is chronic pain, cannabis and chronic pain, different kinds of pain. So you can really get some good resources, because when I talked about, some of that pain and we looked at the different types, neuropathic pain is out there, and that is one of the hardest pains to treat. Very treatment resistant. So CBG, cannabigerol, there's some evidence showing that it could be really useful for neuropathic pain. And that's some of that personalized follow-up guidance that we give you. We give you links if that's what you talk to us about, on where to find more information, because we want you to read that. We're here as nurses. We work with a nurse scope and standard of practice to make sure that we are the teachers, the educators for you, but then we also give you loads of places to find these resources. So you read it, not just believe us because we say, hey, this really works, but also to read it for yourselves and be a really informed consumer. We ask for a $35 donation per scheduled call, but we absolutely 100% talk to everyone and anyone. So if anyone needs a free call, that's all you state, is you need a free call. And thankfully, we have supporters that help us provide those free calls. So that was it. I got through that quickly so we'd have time for your questions. So I'm going to stop the share so we can answer some of your questions. And thank you.
Thank you so much, Katherine. That was so very insightful. I know that I learned more information, and I just truly appreciate you giving of your time and sharing all this information with our community. One of the first questions I want to ask, though, is we keep hearing, can we get copies of these slides? And so I wanted you just to be able to share. US Pain Foundation will send out all information after the fact, but will it be okay if we also share the slide deck?
Yes. So now this is one we did specifically for your community. We love, that's what we're all about, is education, community education. So I will be sending you a PDF link that you can have. Yes.
Perfect. Thank you. Another question was around the durations that you referenced on how long cannabis would be affecting your body and providing relief. And the concern came around, really, it was that they see different durations at different places, and how do we know which way we should go? And it's more around the risks, or making it difficult to know the risks about driving, watching children. And I didn't know if you could touch on that a little bit more.
Sure. Yeah. And I think that's the wonderful part of it. It's just like your pharmaceuticals, as far as duration and timing. So what we tell everyone is, especially with chronic pain, if you have something chronic, it's lasting you all day and all night. So you really want to make sure that the level of that medicine in your body remains at a steady state all day and all night to get your best benefits from it. So as far as cannabis, you look at the different routes, and that's what we can help with. Something that you swallow versus something you inhale, and how long it lasts. The beautiful thing is each route has a kind of the typical. We saw inhalation with 2 hours. So we've helped a lot of people who have used inhalation for chronic pain understand that you're spending a lot of money because it's only lasting 2 hours, and you have to do it around the clock. So really it makes more sense to swallow something that lasts 6 to 8 hours, and now you have longer coverage. So that's the kind of guidance we give, is how long these routes typically last, and and then you can do the math, and we can help you understand, well, then that means I would need to take something I swallow every 8 hours if I want to be covered every 8 hours. So we're able to help you understand when the timing should be and how effective, because that's one thing that a lot of people forget about, is they'll take something for pain right before their head hits the pillow, and then they're up for 2-3 hours because their pain hasn't subsided. And we teach them timing is important. You really want to take that pain medicine maybe 2 hours before you go to bed, before your head hits the pillow, because it needs time to metabolize and actually hit the system. So
that's great. And actually, that kind of dovetails to the next question that we received. And it really was about, how much time do we need to have passed before we know if our body is responding, and or if we need to take more? And maybe that depends on the person, but I'll let you answer.
No, that's an excellent question, because that's where people, without clinical guidance get a little in trouble because they'll take especially an edible that needs to go through your stomach and your liver to now start to feel it. And for you, it might, if you didn't eat, it could be 40 minutes and you're feeling it. Then all of a sudden I ate, just right before I took it. It could last 2 hours before I feel it. So it all depends on when you ate, how you're metabolizing it, and everybody's different. So we usually give a window. I do not take a second dose if it's been less than 2 hours, if it's something edible. And that's because we saw that it could take that long to go through your stomach and go through and start metabolizing. So we give those cautions to everyone. So yes, it depends on the route that you take and how long you can take another dose. It's dependent on how fast it takes effect. So inhalation, we saw that it was 15 minutes, 30 minutes before you feel it. So after an hour, if you're not feeling anything inhalation wise, you would take another one. But you wouldn't do that with an edible because sometimes it could take 2 hours before you feel it.
Okay, great. Thank you.
Mm-hmm.
For individuals that live in states where access to cannabis is either limited or non-existent, and in this particular person, she had mentioned she lives actually in Tennessee, but how would they go about finding a resource for cannabis or some type of CBD product that could help benefit them? Would that be
Yes.
reaching out directly?
Yeah, we do our best to give the resources of like we showed you, a really quality brand that is doing everything they can to almost mimic what a pharmaceutical would need to provide you, which is wonderful. When I created this nonprofit, the first thing I thought was, I can't just teach everybody here, this is what you need, and then not provide resources on how to find the quality products, the tested products. So you can find, if your state doesn't have a medical program or an adult use program, that's where the hemp products come into play, because you can order them and have them shipped to your house. And that's federally legal in most states, and other states are just reducing the amount of THC that can be shipped into their state. But you can still get the cannabinoids, the parts of the plant like CBD and CBDA, that's really great for inflammation. Because remember, when you have chronic pain, there's usually two things that are happening. It's the pain and it's the inflammation. When you're inflamed and it's pressing on those nerves, it's creating more discomfort. So when you reduce that inflammation, now you're helping your pain. So you want to look, so it could be, even though you're restricted or you feel restricted, oh, I can't get THC or I can't get enough THC, these other parts of the plant can be ideal to start with. So, and that's what we can teach you.
Perfect. Thank you. Please keep sending in questions, but there are a lot of them, so we might not get to all of them today. But I hope that you'll come back sometime so we can have another conversation, because there's so many great questions. The next one is around, are there edibles that are made without sugar?
Yes. So, the companies have looked into all the typical types of edibles that a consumer would want. So they have vegan, they have low sugar. They try to make it as low sugar. It depends on you. You have to look at the ingredients just like anything else. They make troches. Troches are something that you put in your mouth and it's just absorbed through your mucous membrane. They have that. They have mints that I've seen with no sugar. So there are companies that are trying to make sure that they fit everyone's dietary restrictions and needs. We have people with diabetes that really have to watch their sugar. Tinctures and the oils are a way that you can. And what's wonderful is those transdermal patches. I do this, but you wouldn't put it there. The cannabis ones are here. Transdermal patches that you can use. So you're making sure that you're not ingesting anything that you don't want to swallow, like sugar. That's another great route or method of consumption.
Great, thank you. Are there any products out there, or are they studying the CBD in suppositories?
Oh, good question. Yes. Yes, there are companies. I was just looking at one today because someone has pain in her bladder, so everybody has their pain in different areas. And we were talking about that as a team because we have a team of nurse practitioners and registered nurses and registered dietitian. We have a phenomenal team that we all pull in our resources. And we've seen some great pain reduction with suppositories. So it's been fantastic. Typically, we think of a suppository as a localized treatment. So especially with men with prostate pain, colon pain, we have people that have rectal pain. Suppositories can be ideal because it's another way to get that cannabis right there at the source.
That's fascinating. That's so
Yes,
great.
but you have to
Yes.
look at the ingredients of the suppositories. I want to put that out. We found that out today, that some of them have essential oils in them, but we want to make sure that it's not irritating to somebody as well. They should be very calming, but we can help with resources at companies that make sure that there's nothing else added in case someone does have a sensitivity.
Great. Thank you. This question, I think a lot of people probably have. How do I know which shop or website to really order from? Do I just look for dispensaries? And then also, when you're taking a lot of other medications, individuals are nervous about maybe potential side effects or interactions. So, should they be under the care of a doctor before adding another option into their treatment plan?
Okay, so two separate questions. So the first one
They
I'll
are, yes,
answer. That's okay. So the
yes.
first one I'll answer is, where do I go find, quality, safe products? Dispensaries, legal dispensaries are always key because you saw how highly regulated they are. They have to follow every state's regulation. So every product in there is has to pass whatever the state laws are. So those are very safe products. The problem with dispensaries is that they're not sometimes focused on the patient anymore. And so they don't have those smaller parts of the plant that could be ideal, or they don't have those ratios. Remember those ratios that were the 50-1, the 20-1, that would be better for daytime? They don't carry those because they weren't seeing enough patients coming in wanting that. So the more you ask for that in your dispensary, hopefully the more they'll hear and want to supply it. But that's when you can go to a hemp company. And we can tell people what we look for. I want to see, who's that company. I want to see an about us page. I want to see who owns that company. Is it just some blank page that doesn't even have a contact number? Those are the ones I stay away from. Like, well, what if this comes, the package is broken into? Who do I contact? If you have no, steps to get a hold of someone, that's where I'm like, oh, I'll pass. I'll go to a new company. So that's that one. And then, yes, 1,000%, you should always tell your primary care team, whether that's your nurse, your doctors, whoever it is. You always want them to know that you're integrating cannabis. They want to know, and I know there's a lot of fear because of the stigma. There's a lot of fear that maybe your primary is going to say, I don't want you taking this. And that's when, if you come to us beforehand, we can set you up with some of that language on how to talk to a physician, how to talk to a traditional care team. Their main thing is they want to know that their patient is using responsibly. And if you say, yes, I have these resources, I have a nurse helpline that I can contact, or we even have resources to cannabis trained MDs and nurse practitioners that can actually take you into their personalized care, and it's out of pocket cost, but you can join their practice and they can go through and give you dosages, and they can even talk to your primary care team. So it's all available to you. But yes, you should 1,000% always tell everyone on your clinical team that you're integrating cannabis, but you are doing it responsibly.
Well, great. And I'm so sorry, we are out of time. There are more questions. We're going to try to answer them just by typing in the responses. I really hope, Katherine, that you'll come back sometime. We would love to have you to just share more about LEAF411, and also just to help inform individuals about the potential of medical cannabis and helping with chronic pain, or being just another tool that's in that toolbox.
Yes. Yes.
So yeah, thank you.
That's
So
the
on
tools
behalf,
I love. Yeah. And thank
yes.
you for having me. That's the tool I love. And that's the last thing I'll say is that, the beauty of cannabis is that this can be, in your little toolkit at home. So when it's the middle of the night, we've had people that just, their pain is out of control, but it's 2 a.m. What do? They can't take another pharmaceutical because that could be a little bit, dangerous. There's cannabis. So that's the beauty of it. So thank you. I would love to be on again, or one of our team members.
Yes. Well, on behalf of US Pain Foundation, I really just want to say thank you again, Katherine, for sharing your deep expertise and perspective with all of us. And thank you to each and every one of you who took the time to be here with us today. We know that navigating pain and exploring treatment options, it can feel overwhelming. And that's why resources like LEAF411 are so, so important. So if you like more support, or if you have further questions that weren't addressed today, please reach out directly to leaf411.org. They are really here for you. They are ready to provide evidence-based information and compassionate guidance. The recording of today's webinar will be available sometime later this week, but in the meantime, please know that both the US Pain Foundation as well as LEAF411 are committed to walking alongside you in your journey, helping you to find those tools, that information, and the community that you need. So thank you again for joining us, and take care.
Bye.
Thank you.